pencil on my keyboard is your reminder to record. We hope that we can answer any of your questions that you have. If not, I'll be certain to follow up, and I'll be monitoring the chat during Sarah's presentation.
Thanks so much, Amy. So as I said, I'm Sarah Bucic, and me and Dr. Rowe have been working on lead poisoning prevention in Delaware for about 6 years now. And we started getting involved in this. There was a project next to my house, and there were lead paint chips falling in my driveway. And I had a 7-year-old at the time, and I started asking questions, and we've been working on policy ever since. So we hope that we can answer your questions here today. Please let us know any questions you have, and we'll try our best to answer them. So just to start off, lead is naturally occurring. It's found on the periodic table. It has no use though in our bodies. There's nothing it provides for our body that's useful, and there's no level of lead that is safe to be exposed to, especially for children. Lead has been used for a really long time in consumer products and industry, and even, it's been banned for a number of years. We'll get into that in residential indoor paint, but it still exists in a lot of places. And so that's the important part of our take-home message of today is it's in a lot of places that we don't know about, and that's why screening children is really important. And it's really dangerous for children because it harms them during critical periods of their life. We know lead isn't good for adults either. It can contribute to cardiac issues in adults, but we know when children are exposed that it harms them during these critical periods of development, and it creates behavioral problems, and there are lifelong impacts. So as I said, there's no safe level of lead in a child's blood. There's no safe level of exposure. You can see here on the right that there are adverse health consequences when kids are exposed to lead. So you can see up here, if a child's blood lead level is 150, they can die. But as we come down closer to 20 and 10 and 5, we can see some impacts that are really serious as well surrounding development. And it can delay puberty, it can decrease IQ levels, it can impact academics, it can impact attention span, and also contribute to antisocial behaviors in kids. In Delaware, if your child has 10 and above as a blood lead level, that's 10 micrograms per deciliter, the Department of Public Health sends out a case manager to the home. So this is a nurse who would come to the family's home and will actually work with the family and try to determine where the lead is coming from. Is the child playing in a sandbox that has something in it? Is it the windowsill? But we know that 10 and below, that there are still very serious impacts, which is why we're very excited that last year, Delaware had the Interagency Coordinating Council approved, including lead poisoning as a eligibility criteria for IDEA Part C. So right now, if a child has 5 micrograms per deciliter or above, they are automatically eligible for these early intervention services in Delaware. We know though, down to very low levels, that lead still impacts children's development. So last fall, the CDC lowered the blood lead reference value to 3.5, which means if a child has this, it's considered elevated, and Delaware will send the family materials and some educational information, and usually will require them to repeat that blood lead level at a specific interval to see if it's come down. So all of this just to say that there's no safe level, but it's really important we determine those levels so that we can get the child away from the source of the lead, and we can also get them in these services. And I'll talk a little bit more about that as we go on. So just to go back over this, lead is toxic. It's toxic to children and adults. Children are very vulnerable. Their nervous systems are still developing. They absorb a lot more. So lead mimics things like calcium, and the body absorbs it into the bone. And so children absorb it the way, everyone on this call knows that children like to put their hands in their mouth. Children aren't the best at hand washing. So there are a lot of behaviors that children engage in that put them at higher risk as well, as in addition to that being a very critical period of brain development. For adults, we know it's not great either. We know it can contribute to heart disease and stroke. And also it's very dangerous for pregnant women because it can harm the developing fetus. And it can also, if you've had lead poisoning as a child and then a birthing person becomes pregnant later on in life, that calcium can release from the bone and affect the fetus. So lead is not good for anybody. And there's no safe level. So here's, I guess, where it gets tricky. We know it's 100% preventable. We know lead poisoning doesn't have to happen, but we know it's still happening. And I will go into some of the statistics that are available to us. And the problem with lead is that by the time we see physical symptoms, it's really very later on in the, the child has had a lot of lead in their body. So a child may not show outward symptoms until much further along in the blood lead level elevation. And we want to catch kids early on so that we can get them away from the source of the lead poisoning. And we know that today, children in at least 4 million US households are exposed to high levels of lead. And we know these numbers are probably higher because we know that not every state has testing of all children. These are just the numbers that we know of. And 500,000 US children ages 1 to 5 are at 5 micrograms or above. So we know it's an ongoing issue. So there are certain children that are at higher risk than others. We'll get to this, but all children in Delaware are to be tested right now at 12 months and 24 months old. We know that children under age 6 are at high risk. They put their hands in their mouths and just they're closer to the floor. There's a lot of other reasons why. We know that the research shows that children in foster care are also at high risk due to housing conditions and going into different, multiple houses. There's new sources of exposure. Babies whose mothers have had lead poisoning. As I said earlier, if a person has lead poisoning as a child and then they give birth, the calcium along with the lead comes out of their bones during that pregnancy process and goes to the fetus. Children who live near industrial sources. There are things like water towers, which was how I got involved. If some of you remember far back 20 years ago, there was the St. George's Bridge, which when they repainted it, the paint chips fell off to the town below and all the children had to get tested. So there's a lot of places outside. Older playground equipment can also have lead in it. There are also, as we know, children who live in older housing. Lead wasn't banned until 1978. We'll get into this a little bit, but that's not a magic number. There is still a lot of lead paint usage, significant lead paint usage after 1978. All the lead paint didn't just go away after 1978. We also know that migrant and refugee children have higher incidences of lead poisoning just due to some of the cultural practices that people bring from other places. And also there have been some concerns about candies and things manufactured in some places containing lead. And then there's also exposure that parents go through as far as their occupational exposure. People who have to fire a firearm for their job, for example, police officers or security officers. Sometimes they have to fire a weapon for their training. If they don't change their shoes when they come home, they can bring lead into the home that way. So there's a number of different risk groups. So when you talk about lead poisoning, people always mention this number 1978 because lead paint was banned for sale in homes and childcare facilities. And that was great. But that, there's a lot of older homes. Delaware has a very high housing stock that is from before 1978. So a lot of times that paint is underneath other layers, old windows. If things haven't been fully updated in a lead safe manner, there's a lot of older residual lead paint still in existence. It wasn't until 1986 that lead was banned in solder and piping. So if you had piping put in your home or your facility, anytime up through that time period, it could still have lead in the solder. In 1996, lead was banned in gasoline for road vehicles, but it's still used in some aviation and jet fuels. And in Delaware, we had lead testing and limits set for children's toys in Delaware, but it's still permissible in plastic. And to date, Delaware is the only state that has passed a lead paint ban for outdoor structures. In 49 other states, it is still legal to apply lead paint outside. So that means on things like fire hydrants or metal structures outside, those all can legally still be painted with lead, which a lot of people don't know. So as I said earlier, people tend to be really surprised with this statistic. We think, oh, my house is new, I don't need to worry about lead. But about 6.6% of houses in the US still contain lead, even though they were built between 1978 and 2005. So lead continues to be a risk. And we know this is just in housing units. We know there's many other sources of lead, which we'll get to. But as you can see, the older your house is, the higher incidence there is of lead paint. Back to where if your house is before 1940, it's about an 87% chance that your house will have lead in it. And the lead industry did a really great job with their marketing, as you can see here. This is all the Dutch Boy marketing campaign that the lead industry used. So they had a lot of advertising, and we knew that lead paint did cause problems, but it took until 1978 to ban it for residential use and for us to start taking it out of gasoline, which is really unfortunate for the health of our children. So if you don't have lead in your home, where are some other sources that you can find lead? So basically everywhere. There's a lot of things like imported supplements and health remedies where they found lead. There's been a situation just in the last few years where they found high content of lead in spices like turmeric. Candy from Mexico is frequently coming positive for lead. Imported aluminum cookware, as we saw in Flint, Michigan, when drinking water gets changed over or something happens, the lead can come out of the solder and pipes. In old dishware, a lot of old dishware has glaze on it that has lead in it, cosmetics, and also restored or upcycled furniture. So if you know people who are in the furniture restoration, that can actually be a main cause of lead poisoning if you're refurnishing old furniture. A few years ago, your childcare providers, I'm sure you all remember fidget spinners. They actually had content of lead in them. And, kids, when they were using them, were touching their mouths, and my kid used one. So there was definitely a lot of hand to mouth behavior. It was very frightening. I thought that they found lead in them. It was actually in the ball bearings. A lot of costume jewelry has lead in it. As I mentioned earlier, if you have anyone who participates in marksmanship or firearms, a lot of these people are younger, like in 4-H. You can have exposure to lead. Recently, there was a recall of applesauce. So there are often food items that will come up with lead in it. Many times this is from the soil that the food is grown in. So just because we banned lead in gasoline, our fruit sometimes comes from other countries in places where they might have used lead in gasoline more recently. And even if they used it a long time ago, it still can be in the soil outside here as well in the United States. Fruit juices have been found to have lead. As I mentioned earlier, if you have anyone who participates in firearms, that lead dust gets all over your clothing, and you want to be able to change your clothing before you touch your child. If you have a vegetable garden, you always want to have your soil tested. There can be contamination from the soil, and there's a lot of art supplies that actually have lead in them, especially things like stained glass work. So as I mentioned, you can see here, there's been a number of recalls. This was all this year. Baby bottles, which were just recently recalled due to violating a federal lead content ban. There were blueberries. That was due to the soil that the blueberries were grown in. And then these on the bottom, these dried salted plums. And there was a number of brands of these plums that had tested positive for lead. So there are a lot of places people can be exposed. And so we really, if you get nothing else from today, other than it can be from a lot of places, and that's why we really want to get kids screened, then that's the main message for today. You don't know, there's so many places. This is just showing the micrograms of lead per serving. This was a spinach with bacon salad kit for one that came, very positive. There's so many foods that get tested and various products. This is just to show you that you're trying to eat healthy and eat these fruits and vegetables, and you can still be consuming large amounts of lead, which is very concerning for young kids. So something that would be of interest to this group in particular is older playgrounds. When Amy and I first started working on this, we were contacted by a person who lives in Arden, and we were told that they had an older playground there that had lead, and they were doing some soil testing, and they weren't sure how to go about it. So we were looking into a lot of, we're in Newcastle County, there's a lot of playgrounds that have been updated and, have modern playground equipment, but especially in neighborhoods and a lot of places that aren't owned by the county, there's like little playgrounds, and a lot of them have those old lead paint, among other hazardous playground equipment, but there is a lot of lead paint on them. This is Amy and I when we tested some playground equipment in Newark, and it did test positive for lead. Sometimes even when playgrounds are updated with rubber mulch, they have found that there can be lead from the vulcanizing agents used in that rubber. Even in artificial turf, as it ages and weathers, lead is released in the dust that can then be ingested and inhaled. And they actually have done a number of studies that find that there are seasonal exposures where children have more cases of lead poisoning are found in children as they go outside to play in the summer. And this is particularly evident in like places that have prior historic industrial use. There's a lot of these old smelters, steel plants, things like that. And children go out and they play in the soil. Those plants may be long gone, but children are still being exposed to the contaminated soil. So we tell you all this this isn't to scare people, but it's to empower you to do, actions and behaviors like wash hands. That's really important. I mean, that's one of the main things we can do. We can have kids wash their hands after playing in the soil because we know the hands will probably go near the mouth. Also removing shoes when you come inside. This is something that a lot of lead workers talk a lot about, having special tracking mats, putting things in front of the door so that all that soil isn't coming into the child care center or the classroom. There is a higher incidence of children being exposed to lead when there's no grass, when it's bare soil. So planting grass and ground covering also helps. And then if the paint is peeling, to test for lead, you can buy test kits at, Home Depot and Lowe's, and they can tell you right away if you have lead in your paint. I think, sorry. So there's also the possibility that if you have the ability to test your playground soil, the University of Delaware has a cooperative extension program. It's less than $15 or $20. You can send them a sample and they will let you know if the soil contains lead. So that's also another resource. So as I've been saying over and over, lead can literally be anywhere. When Amy and I first started looking at this, I don't think we realized all the places that lead was found. As I told you, there was this playground in Arden. This was on the left-hand side of your screen. This was lead paint on a trampoline in Newark. That was from the sandblasting of an outdoor water tower that had a containment around it, and the wind blew it open and it went all over children's play equipment and the yard. And unfortunately, the family was not notified that there was lead all over their yard. So that was on their trampoline. On the right side of your screen, you can see the lead paint being removed from this large water tank right behind people's homes. There are now regulations that we've worked on. So when they do these kind of projects, they have to tell people but at that time that they were doing this, there were not. So this is in real close proximity to people's homes a lot of times, this stuff that's happening. And so we really just want people to have information, what lead is and how they can, use best practices to keep from getting into contact with it. So one of the things when Dr. Rowe and I first started looking at this is we wanted to know how many kids in Delaware were getting tested. As you all know, lead testing is mandatory in Delaware at age 1, and since last year, it's now mandatory at age 2, so 12 and 24 months. We don't have great numbers in Delaware. We have a lot of needs for better data, better maps, better information. But from the data we do have, we know that about less than half of the kids are being tested. And we know that from the kids that are being tested, that there are a significant number of kids that are coming up above the 3.5. So this shows you that, between 2016 and 2021, over 2,000 children experienced blood lead levels above 3.5. And this is incredibly problematic because during the pandemic, that number dropped really further. So we know that about less than half of the kids in Delaware are getting tested on schedule. And then during the pandemic, that fell, it was halved. So kids were missing their well visits. They weren't, going to the doctor unless they had to. So those rates dropped off. Then also during the pandemic, there was a recall of some of the blood lead testing equipment for finding kids' blood lead levels. And so there was an even further drop. So we know we don't have great statistics and data right now, but it's a little bit less than 44% of the kids were getting tested at age 1 as required by law, which I'm sure this group is familiar with, that, not all kids are getting tested on schedule. So ideally, kids do get tested at age 1 and 2. It's preferred that they, get the capillary finger stick, just because the results can be obtained right when the child and family are in the office visit. And it's fully reimbursable under health insurance contracts. And if you do have an elevated level when you get the capillary screening, they do want you to repeat it with a venous test for the child. So a lot of times providers don't have those blood lead analyzers in their offices, and they'll hand a family a script and the family will have to go get the venous test, which does create another barrier. But that does confirm if the blood lead level is elevated. There are screening locations at community health fairs and at these specific state service centers that are listed here. The state service centers are for uninsured, and it's by appointment only. So screening, as I said earlier, is now mandated for all children at 12 and 24 months, regardless of risk factors. We used to have this thing called the questionnaire. Over half the state was listed as a high-risk area just due to zip codes. So really, screening questionnaires are not considered effective. So the blood lead screening is the most effective thing. All lead screening is reported to the Department of Public Health. So this is a really important slide. Who is required to verify that screening has been completed? Well, childcare providers are obviously checking that, and school nurses for enrollment. School nurses, we really don't want to be checking kids when they're age 5 or 6 because they have had 90% of their brain development by that time. It's great if we can pick it up then, but it's really too late. We want to find out that children are lead poisoned early on. Pediatricians and other healthcare providers, they are supposed to be doing the testing, but as probably many people on this call know, that can be difficult sometimes due to a variety of factors and barriers. And foster care agencies also are not required to verify that screening has been completed. We'll get more into that in a minute. And screening should also be performed for children of any age whenever the child has been suspected to be exposed or exhibits any behavioral or learning symptoms. And this goes for even if the child is over age 5 or 6. So the questionnaire has been discontinued in Delaware. They're no longer to be used for lead screenings. And just recently, we know that that was taken off the Department of Public Health's website. Screenings must be a capillary or a venous blood test. And as I said earlier, the CDC lowered the blood lead reference value to 3.5 last fall. So it was in 1985, it was 25. That was what was considered the action level. In 1991, it was 10. We are still using that number to provide case management in Delaware, even though we know that much lower levels are problematic and cause developmental delays. But that is the number we're using in Delaware. We know that at 5 micrograms and above, which when the CDC lowered the blood lead level in 2012, that now those children as of last year can receive IDEA Part C. And we know as of last fall, 3.5 is considered the action level by the CDC. So what this does as we lower the blood lead level, the reason that this happens is the CDC wants to target children who are in most need of services. So when they lower the blood lead level, it's not just an arbitrary lowering. People are always saying, well, blood lead levels are coming down, and they are coming down, but we're also finding out more and more information that, lower and lower levels are still a problem. So this essentially doubles the amount of children who will require intervention by the Office of Public Health. So lead that is not excreted is absorbed by the body. As I said earlier, lead goes into bones and teeth. It goes into soft tissue, specifically the brain and kidneys, but it goes to a number of other organs. Children absorb 50% of ingested lead after a meal, and they can absorb 100% of ingested lead if they have an empty stomach. So most of the lead that children are exposed to is through respiration. So dust in the air, lead dust. And blood lead half-lives every 1 to 2 months. So if the exposure was a really long time ago, you might have a lower blood lead level if it was a one-time occurrence. So basically, this slide just shows you that we know at very low levels that children are impacted by lead poisoning. At less than 3 micrograms per deciliter, it can decrease the end of grade test scores. At 4 micrograms and below, at 3 years old, it increases the likelihood that a child will be classified as learning disabled. I mean, these are real impacts that educators see. And this is why we want to identify kids early on and get them into early intervention. Even though lead poisoning is not reversible, we do know through research that if we find the source and we can get the child away from that source and get them involved in early intervention, their brains are young and they are pliable, and we can stimulate them and they can recoup some of those impacts if we can find them early on enough. So early childhood education helps kids overcome the neurological effects of lead exposure. And it can even help them avoid the need for needing special education services if we can find them early. There's a lot of talk over the years about lead's effect on the brain. And we know that there is a lead crime hypothesis. This is something that we've been talking about at some of our meetings of the Childhood Lead Poisoning Advisory Subcommittee. In Delaware, we have been testing children's blood lead levels since the 1990s. And the children who were tested in the 1990s are now well into their 20s, and some are close to 30. So we know that there should be some availability to look at, the lifetime outcomes of children who were exposed at an early age. And it's definitely just another preventable thing that that child now has as a barrier. So screening. This is why screening is so important. We went over all these different places where lead is found, all of these outcomes, but screening is the best, most reliable mechanism to identify kids who need help. We saw over the years people using questionnaires, and people, I mean, I've filled out the questionnaire as a parent. I didn't know how old different things were in my house. I mean, we know that the blood lead test is very accurate, and it's something that can be incredibly helpful and life-saving if it's done. And so we know that it's a diagnostic tool, and we really want to inform people so that when people, have to get these blood lead tests, that people understand why it's so important. And it's the main thing that initiates the process, where public health is then notified and a caseworker can come out and actually begin helping the family. And the blood lead test is required for the child to be eligible for IDEA Part C. So even if a child has been exposed without that blood lead test at 5 or above, they wouldn't be able to get those early intervention services. So it's really important, to prevent the exposure, and then once it's found out, to engage and begin educating and getting the child help. So we would encourage people to advise caregivers to help them identify the source of lead and prevent exposure. There are all types of home risk assessments that can be done. The Department of Public Health has a Healthy Homes program, but just being aware of all these different places where lead can be found is incredibly helpful. There's another intervention that is incredibly useful. Children who have good nutrition it do fare better when they have been exposed to lead. As I said earlier, children with empty stomachs absorb more lead, and also calcium reduces lead absorption. So if you have a lot of calcium in your diet, it helps your body not absorb the lead into the bone, and it also helps make their teeth and bones strong. So that's we always advise people to have frequent meals and have healthy meals with calcium. So this early childhood education helps children overcome the neurological effects, so that children, can start with their peers and, have lessened the impacts of lead poisoning. So early education is really critical. We can provide you with references if you want to find out more about that, but it can reduce the reliance on special education. So what can you all do? I know that you are all already doing verification of lead screenings as childcare providers. But one of the things we really wanted you to see today is why these screenings are so important. If you have the opportunity to, share any of this, that would be fantastic, because we know that people are really busy and it's just another thing to do, but it's really something that can be incredibly beneficial if it can detect something that can prevent a lot of problems in the future. Maintaining a lead safe environment indoors and outdoors, that goes along with prevention. Using recalled products, we want to just encourage people to stay aware of various things that get recalled. We have a blog where we put things up there, but there's a lot of consumer websites that talk about this kind of thing, and really emphasize hand washing and taking off shoes when you come in the house. And you can, public health is going to be working on, making sure that when parents have children with elevated blood lead levels, that they are referring them to this IDEA Part C, but you can always, remind parents to let them know that they are eligible automatically at 5 or above. And this is the new director of the Lead Poisoning Prevention Program, Kurt Ollinger. So if parents have any questions, you can always refer them to the Department of Public Health's Lead Poisoning Prevention Program. And we know you are all the gatekeepers of compliance. I know a lot of this falls on childcare providers. That's incredibly frustrating process, because I know that you are all checking, and verifying things. And at the same time, a lot of it is outside of your control, whereas, the people who need to be performing the tests and things are a different group of people, but you're providing a really critical role. So I just wanted to acknowledge you all and thank you for your help in addressing lead poisoning in Delaware. As Lead Free Delaware, we did come up with a one-pager about lead and what people can do. We have this on our blog and we can share this with you. And so far we have it translated into Spanish, Haitian Creole, and Mandarin Chinese. So we can get these to you if you want to share them with parents or other providers. And I don't know if anyone had any questions, but that is the official end of our presentation. So I am looking forward to hearing from everybody. Amy, did we get any questions?
We did get some questions in the chat. There was some, I think, very important clarification in the chat about what happens if a child has a screening for their 12-month screening that's late, or perhaps categorizing missing their 12-month screening and then getting their 24-month screening early. So the answer to this from Kelly McDowell at the Office of Childcare Licensing is that if children have a blood screening after 18 months of age, an additional 24-month screening is not required. I do know that this issue came up with the regulations from the Department of Health and Social Services, because they don't define a 12-month screening or a 24-month screening to clarify that. And those final regulations are not released. So I'm not sure if they're going to address this issue in their regulations or not. I know that we asked them to. We asked them to address this so that it is official. But it seems as though the Office of Childcare Licensing has their own procedure. We also had some questions about the impact of lead poisoning and the half-life and what that means. And I just want to clarify that if you had a lead exposure, then the detectable lead in your blood goes down over time. And so half-life means that at a time period, half that lead has then been either flushed from your system or absorbed in your bone. And so it's not an indication that you're better off because you've experienced a decline over time due to half-life. It means that the amount detected in your blood has gone down because of the way that lead interacts with your body system. So if you had a lead exposure 6 months ago, and now you get a lead test and it shows that your lead is at a certain level, it's just not an indication of what your lead level has always been. It represents sort of a declining amount over time. Okay, Kelly McDowell responded to the issue of the 18 months, 12 months, 24 months, and that they are looking at the legislation that was passed. That was HB 222, which was passed in 2021. It says a 12-month test and 24-month test, and it doesn't sort of resolve this sort of off-cycle issue. If this continues to become a problem, then perhaps we can address it, but hopefully we can all work this out without the need for more legislation. Dawn, you have your hand raised.
I do. Thank you, Dr. Rose. So actually, I see you're saying that there's still an error. I'm going to give it another try. Oh, I have some responses. So the link for providers to request a certificate is now working. So I can pop that in the chat again because it is working. I see people, forgive me, initially I had it restricted so only people with my work could access it. I'm sorry about that, but I've changed that link so anyone can access it. So that has been updated. And then the other thing I wanted to share is regarding regulations. It's a little bit tricky. So the Office of Child Care Licensing is now within the Department of Education. And so OCCL has regulations that are under Title 14, which is in Department of Education. But then there are still lead regulations that are not finalized under the Department of Health and Social Services, because those are the regulations that doctors, other medical professionals have to follow. So it's tricky, but that's sometimes that happens with a lot of our laws. in Delaware that if there is a law that is passed that impacts, let's say, teachers and medical professionals, it impacts, I'm just making this, private schools, childcare providers, et cetera, the different departments that oversee that work will have to put forth regulations. So one group of regulations might be done and ready to go for one group of people, but then for another group of people, that department, those regulations may not be finalized. So that's why you're hearing maybe two different messages about regulations. The Office of Child Care licensing regulations are good to go, but then the regulations that impact medical practitioners are not finalized. And so I hope that makes sense, what I was trying to clarify there. Thank you.
Thank you. Thank you for doing that, Dawn. Kim York, I see you have your hand raised.
Yes, I just had a question if there's any, I don't know if we have any providers, physicians on the call, but I know in the past when I have brought up the issue about children getting tested later, because it's an issue, when to do that second test. And the guidance that I have received has been 6 months, approximately 6 months after the first test. And so I don't know though if that's something that other providers, physicians would agree with, but we are identifying that this is an issue and that children do need to be tested twice. And if just because they're tested later doesn't mean, obviously now the legislation with schools, they have to be tested twice, but there is definitely lack of guidance around when should that second test be done.
Yeah. Thank you for that. I wanted to add that the American Academy of Pediatrics has said that children are most likely to be exposed to lead at age 3. So we still have work to do as far as screening and when to have screening. So I'm very glad to hear that even if a child gets a lead screening, the first screening late, that the second screening shouldn't be passed because they still are in this window of a high potential for exposure. Did we have anyone else have questions?
I'm raising my hand again, Amy, or Dr. Rowe. So Dr. Rowe, you are leading, talk about the Childhood Lead Poisoning Advisory Committee and how I know it's really hard for providers to be able to attend meetings during the day. So we're extremely grateful that you're here right now. So thank you so much. But how can providers, because it's really powerful for people who are leading this work to hear from people who are on the ground working with families and children every day, who are where as Kim York had said, where more clarification is needed. So how can providers get that information in a streamlined way, or to the people who are making the regulations or who are communicating what the requirements are? What would you recommend?
Yeah. This is a great question. It's an incredible source of frustration for us. When Sarah and I first started doing this work 6 years ago, there was no Childhood Lead Poisoning Advisory Committee. It didn't exist. It was established by law, but it had been allowed to fall apart and had not met since 2012. So one of the things that we tried to do was get that restarted, because having a community of people who are supposed to meet on behalf of government to deal with this issue is still very important. So we had a bill that reestablished the Lead Poisoning Advisory Committee, and we worked very hard to get the composition of that committee to be one that was very inclusive, and we failed at that. It's not a very inclusive committee. The governor's office and legislators, did their thing, and they whittled it down to a very small body that's mostly the representatives from different government agencies. And then there's a couple of seats for community members. And so we've got some of those community we have one of those community representatives on here today. I just wanted to say hello to Sandy Spence from Sussex County. She's the Sussex County representative. There are subcommittees for the Lead Poisoning Advisory Committee, and those are where a lot of the action happens. So I currently chair the data subcommittee of the Lead Poisoning Advisory Committee. Don, who's been active in the chat and is on here today, chairs the primary prevention subcommittee. And then we've got Dr. Shirley Klein. She's participating here today. She chairs the healthcare subcommittee, and they meet once a month and have had a lot greater participation, but the time of day is not very good. The time of day for, different cohorts of people is terrible. And I will also say that the Lead Poisoning Advisory Committee used to have an education subcommittee, and they dropped it. So there's no education subcommittee anymore. I have been asking that that be reestablished because I see there's incredible importance for that, but it hasn't been formulated yet. So we are struggling really to get the stakeholders and the decision makers in the same room. And that's one of the reasons why Sarah and I have been so eager to get out there and talk to people where they are, because carrying that message back is very important. But we do have incredible need for a lot of the burden, right? The burden of this issue on childcare has not been discussed. And there's really no forum for it to be appropriately discussed right now. So we need to kind of open that up. And that's something that, I'm really hoping can occur, because I see, I actually heard a lot of this frustration for the very first time at the public hearings for the Office of Childcare Licensing, the public meetings, not hearings, for their new regulations. And, I looked it up, the General Assembly, in fact, I printed it out. The General Assembly has required verification at childcare level of lead screening since 1995. That bill passed in 1994. Now it's part of the Office of Childcare Licensing regulations. And so that's sort of brought that up to date. And I think it's, it's very good, but it does highlight a very important issue, which is that childcares must verify the work of physicians, and physicians are not required or held to any accountability for doing that. And so we have really a problem here that needs to be resolved. And I don't know how to resolve it. So I would like to, learn from you about, what the best way to proceed is, so that healthcare providers can do their job too. And part of the issue has been that healthcare providers don't have the equipment to do the screening in office. So then they write a prescription, and then does the parent follow up? And then maybe the parent doesn't follow up. So then the childcare provider figures this out and sends the parent back to their doctor. Like, that's sort of the cycle that's going on. So getting the equipment in doctors' offices has been a big focus. It's been a big focus at the Lead Poisoning Advisory Committee. It's been a big focus of advocacy. I don't know how many times I've testified at the Joint Finance Committee to just ask, please fund the machines. So if there's a lot of working parts to this, it's a big puzzle. There's not a lot of accessibility to the issue. And I will tell you, when we first started doing advocacy on this, because Sarah and I are like sort of doing this advocacy in our free time, we butted our head right into this wall. And so some progress has been made. Not all progress that we need is occurring. We desperately need help. We'll hope that you'll be vocal and raise your concerns, suggestions, and move this forward, because we really need to eradicate lead poisoning in Delaware. Dawn, I see you have your hand raised again. You're muted.
I'm raising my hand to make sure Heather had a great question in the chat, but just went to me. I want to make sure she has a chance to ask it.
Okay, great.
Okay, so my question is, if children at age 3 are most likely to show exposure, why are we testing at 24 months? Why at 1 and 24 months? Why not 1 and 3? Or you know, my question, I mean, I personally have had several kids because of COVID and the restrictions and doctor's appointments, went in late, got it at 18 months. I'm being told by licensing, they do not need to go through that again. I've already put that out to them. Now we're
Right.
being told that's not finalized. But why, if the exposure is being shown at age 3, are we not testing a little bit later than 2? You're testing at 1, you're testing at 2. Then what happens if they just start showing exposure at 3? They're not getting tested again.
They're
How is
not
that being
getting
picked up?
tested. So they should be getting tested at any time if there's a risk factor. Sarah's presentation showed that risk factors can come from anywhere and we don't know what they are. They could be totally left field. They could be some spice that grandma puts in the soup and you don't know. So this is a huge problem. Some states test more frequently than at age 1 and age 2. I will tell you, getting 2-year testing passed in this state was very hard. It took 3 rounds at the General Assembly. The bill failed twice. And who opposed screening children at 24 months was pediatricians. Pediatricians opposed screening at 24 months, even though 24 months is a critical period of identifying lead poisoning. And the director of Health and Social Services, Department of Public Health, Dr. Carol Rattay, testified at the House hearing on this bill on our second try and said, don't screen children for lead poisoning because the finger prick harms children. She said a lead screening harms children. She's a licensed pediatrician. So getting the medical community to get on board with screening and acknowledging that they have an obligation has been a very, very heavy lift. And we should be doing more frequent screening at age levels. There's research that suggests that school-age children should be screened for lead poisoning if they exhibit deficiencies in reading or behavioral problems or are falling behind in math and science. So, I mean, lead is toxic to the brain and causes brain damage. And the screening is like the important step to identify if it's occurring. And to directly answer your question, why aren't we doing it at 3? We're not doing it at 3 yet. I would like to see it done at 3, but getting 2 was very, very hard. And so that has been a real problem. Did I adequately answer your question or did I leave something out? Okay. Shirley Klein, Dr. Klein has your hand up.
Yes, I feel somewhat that I should defend pediatricians since I am one. But you are correct, and not just pediatricians, but many physicians did not want the changes because they don't want the burden to fall on them. And, they felt that, gee, we're ordering the test, which I don't even know if they're all ordering the test. I would suspect not, but they're ordering the test, but then the child does go to the lab and they don't want to be burdened with chasing all these children who weren't taken to the lab. And not all of them want to invest in the machine or the time that it takes. So, and I was there when Dr. Rattay made her statement and she is leaving. So I don't know what her replacement will say, or even if she has a replacement yet. The American Academy of Pediatrics, I think, doesn't say that exposure is at age 3. It's in the first 3 years. So testing at 12 and 24 months will catch virtually all of them. And there is still environmental exposure, and it's hard to fight that. I'm sure there is a lot of politics involved as well. And that's why it took so long to pass this legislation. I personally think children should be tested at 1 sooner if they're at risk sooner. I've seen kids with lead poisoning at 9 months. We tested that child because a sibling tested high. So then you test everyone else. They should be tested at around a year, and they should be tested at around 2 years. And I don't think one test at 18 months is enough, even if it meets the regulations. But even that, if every child were tested, is much better than we're doing now, where a lot of kids are just not getting tested. And then the burden falls on the school nurse because she has no results and the child is there starting kindergarten, which of course we already said is too late to prevent most of the damage. So those are my
Thank you, Dr.
comments.
Klein. Sarah, I see you have your hand up.
Yeah, I just wanted to add on just to what Dr. Klein was saying, that, we have had blood lead testing mandatory in Delaware for children since the 90s, yet we don't fund our lead program at all. We are the only state other than West Virginia on the East Coast that does not fund its lead program. So I think that there's some issues that need to be addressed. Dr. Rowe and I and the Childhood Lead Poisoning Advisory Committee have asked numerous times for funding for the lead program. There's some resistance there, and I don't know what that is about. So just wanted to add that in.
Well, I see we've hit time.
Yes,
I
we
wanna-
have. And I just wanted to say a special thank you to Sarah and Amy for presenting today, for providing us with this valuable information. Thank you to everyone who attended, for joining us and participating in this. We are going to be sending out a follow-up email that has this information. There will be a recording of this session. There will be the presentation. We'll have the one-pager sent out again that you can also share with your networks. And then there'll also be a short survey, and on that we'll have a comment section. So if you think of other things, if you have suggestions, anything, feel free to write it in there because we would love to hear from you. So thank you everyone for coming.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.